I'm Dr. Joseph Frysz. I work for South Georgia Spine and Joint Center. This is Chandler. She's going to be my assistant in this demonstration. One of the common pathologies that we see in this clinic is with respect to the knee, degenerative arthritis of the knee. Following a hyaluronic injection with Dr. Rowe, which is usually once a week for 5 weeks, we'll incorporate physical therapy and or bracing of the knee. It's usually 3 times a week for 6 weeks. So we're going to demonstrate some of the exercises that we do not only in the clinic, but we send home with the patient. We found that combining physical therapy with the hyaluronic injections and bracing, that we get the best treatment outcomes with return to functional mobility and return to daily activities. So the first thing that we're going to do is we're going to try to restore quadriceps control, or get this particular muscle to activate again. It only takes 20 to 30 milliliters of fluid or swelling in the knee to shut this muscle down. So the first thing we want to do is get this actively engaged, and we would do that with a quadriceps set. Okay, so what I want you to do, I want you just to tighten this muscle for me and hold. You can hold that for 10 seconds. Another exercise that we do is a straight leg raise. Not only engages the quadriceps, but also engages the hip muscles. This is another exercise that we use, the TheraBand foam. It changes the surface area. The feedback we get from the hard ground is different when we change surfaces to where there's less proprioceptive feedback, and it becomes more difficult. Your body has to adapt. So we do balance training on these during the knee program to promote carryover with dexterity, balance, and proprioception, or the awareness of a body part or a limb is in space, knowing that you're lifting your leg. That's essential because when we walk on uneven surfaces or on gravel or stepping off a curb, who hasn't at time or another had their foot slip, and then you have to have the awareness of recovery. And you get that awareness and the ability to recover by improving balance and proprioception, and this starts in the clinic. So by giving patients home exercises, we're looking to get carryover of the gains made in physical therapy. Typically, gains, we're referring to range of motion with respect to the knee, a decrease in swelling, an increase in not only tone, but physical strength. Those are just a few of the exercises and therapeutic activities that we do in the knee program, combining the hyaluronic injections with Dr. Rowe with physical therapy, and also the home program to get successful outcomes. When patients go to their primary care doctor, their orthopedic, nurse practitioner, or chiropractor and get a referral for physical therapy, they have a choice in who their provider is. If Dr. X says you can come and see our therapist, you're really not obligated, unless you absolutely want to see their therapist. We've had a lot of success working with Dr. Rowe and the hyaluronic injections and our knee program. It's been very good for the population that have degenerative joint disease who don't want to go through surgery and still be able to function. I'd be happy to assist you any further. You can contact me at South Georgia Spine and Joint or through the internet on our website. Thank you.